Okay, we're going to get started with the community health textbook. I want to point out first of all that we're going to cover the first two units in this book. Unit 1, the foundations of community health, talks about who provides community health, who provides services, government agencies, volunteer agencies and such, program planning. Then after we cover that and we go through the lifespan, talking about community health, dealing with infants through elders, we'll come over to Unit 2. And on Unit 2, we talk about the healthcare delivery system itself. So there's really two major parts. In this class, due to time constraints, we probably won't get to the third unit of environmental health, but we do have a course for that. So first of all, I want to talk to you about how to read a textbook. You may have never heard this before. What we want to do is go to the chapter, and each chapter has chapter objectives. With these objectives, you want to read the objectives, and then you just want to flip through the book, reading the captions, reading the italicized words, looking at the figures, and you do this just through the whole chapter. Just looking at the overview of the chapter, not worrying about the details. Now, at the end of each chapter, you're going to find chapter summary. Within the chapter summary, you'll see that we go through this and it provides where the chapter ends, if you will. So read the chapter summary and then look at the review questions. The review question sort of tells your brain what you need to be looking for and what you should get out of the text of that chapter. So go through the chapter, read the terms, read the captions, look at any figures. Go to the end of the chapter, read the summary, and now you're ready to go in and read the details. Now, what I'm going to do for this chapter is to flip through some of the pages and highlight some of the key points and things you really need to make sure you have. First one couldn't be any more basic, and it's how we define health. Now, it's so ambiguous, it's hard to come up with a good definition of health. So I want you to go through these different definitions, and you really need to say, this is how I'm defining health, and this is what I'm supporting that definition with. Also, with health, then we have to define community and what we're talking about. We're no longer talking about neighborhoods, blocks. We may be talking about the community of Facebook. We may be talking about the community of everyone who works for Google, everyone who attends a community college. So community is certainly not geographic anymore. Then we come over on page 7 and we look at what defines public health systems, community health, and population health. A lot of different definitions that you need to have in your mind straightened out so that you'll know exactly what we're talking about as we work our way through this text in this course. Now on page 8, you're going to see at the bottom of that figure 1-1. This is one of these figures that you just have to be able to explain. Physical factors, social and cultural factors, community organization, individual behaviors. All this determines the health of the community. This is one of those, someone can stop you in the hall, ask you to explain this, and you need to have a couple of minutes to explain how all these factors work together. It's that important to the process that we're going through. In the next few pages, we'll explain each one of those areas. Now, we also have to have some history in public health, knowing where we've started with. Early civilizations all have some form of public health. When we get into the 18th century, we start to change things a little bit, and we demonstrate that smallpox was where it came from. We have starting to think about germ theory here, not quite there, but we're starting to get on that timeline. Now on page 13, you've got box 1.2, and this box gives you a nice summary of the ancient times and takes you through that. Even in the Middle Ages, the problems we had, and we started to get into this spiritual era of public health where we thought things were caused by spirits and so on. So make sure you look over that. And then in the 19th century, we start to become a little bit more aware of what's going on in public health. We have Snow with his water pump that later turned into the field of epidemiology, sort of the science of public health. Then we get into the modern era of public health. And then on page 15, we actually go into start to learn about bacteria and the period, the 1875 to 1900. We're talking about the bacteriological period of public health, where we start to associate different germs, bugs with different diseases. Now, the 20th century health resource development period, the early part, if we start building a lot of hospitals, but we just don't have a lot of staff in those hospitals, but we start building some infrastructure. As people came to the United States, we had trouble in overcrowding in our cities. We also have more workers than we can use, and we start to get some pretty bad conditions in the workplace, overcrowding, and that comes to the forefront during this period. 1920s, we start to have more health issues come to mind. Of course, Prohibition is a big one. It starts trying to look at alcohol and the effects it's having on the country. Of course, we know that didn't work out so well. And then the Great Depression and World War II had severe effects on the public's health. And the Social Security Act of 1935 was the start of the government's major involvement in health. Now, as we flip on over to page 18, we get into the periods of social engineering up in the 60s and 70s. This is when we have Medicare, Medicaid come online, and we start to try to guide the society in a healthier direction. 1974 on through now, we're looking at health promotion. We realize that we can't cure everything, so we're going to have to prevent things. This is the start of CDC studying premature death. Healthy People comes out with national objectives. If you look on page 19, you'll see in box 1.3, that's a nice overview starting 18th century up through present day, and it hits the highlights for you. Again, you need to spend some time with this. Not expecting you to learn these individual dates, but you need to be able to speak to these broad headings. Community health in the early 2000s. Of course, we're talking about healthcare delivery now with the election coming up. We have our environmental problems we're dealing with, the lifetime diseases, and with communicable diseases coming back online, or coming to the forefront again, I should say. Bioterrorism, which now we've sort of termed just all terrorism. Bioterrorism is a form of that. We have a large issue with alcohol and drug abuse, and now with more disasters, either conventional or human-made. We're looking at preparing for disasters. And this is all led to, on page 23, public health preparedness and medical preparedness. So you make sure you know the difference in those. And the end of the chapter goes into a nice overlook for community health, what's coming up and what's predicted. Of course, no one knows, but this does try to give you some lessons from the past and what we may need to expect in the future. Page 26 and 27, we talk about Healthy People 2020 and what we're looking for there and the goals and objectives that were set forth for 2020. Chapter closes with 2020, and then make sure you go over the chapter summaries again. And by now, as you read those chapter summaries, you should start to be able to speak to each one of those and explain each one to someone else. That's kind of the benchmark. If you can explain these to someone else and adding your own details to them, then you know you're ready to move on to the next chapter. And of course, you should visit the review questions again and be able to answer those questions with some detail. Okay, now let's do an overview of Chapter 2, Organizations that Help Shape Community Health. These are the organizations throughout the world, and particularly the United States, that delivers health care, works on prevention. These agencies are responsible for the public's health. Again, we'll start with the course objectives. Make sure you read over those. As you'll see here, we're going from why we need organizations like this down to the World Health Organization internationally. Then we go down through the Department of Health and Human Services, national, down through the state and local agencies, looking at the core functions of public health and the 10 essential public health services, down through the different types of public health organizations, and ending up with corporate involvement in community health. So as we come into this one, you'll see that today's communities, unlike those in the past, have a difficult time responding to public health crises and needs. Now, there's 6 different factors for that. They range from highly developed and centralized resources, instead of being local, ending up with a top-down funding, where the funding stream has to involve someone maybe at the federal level to get to the local areas. So pay attention to those 6 reasons why we need community organizations to respond to health care issues. Now, on page 35, we start with the World Health Organization. So we're going to go from international down to the local agencies. The World Health Organization has headquarters around the globe, and you can see those on the top of page 35. Started in 1945, realized in 1948. So a little history of the World Health Organization. Now on page 36, you'll see the purpose and work of the World Health Organization. You really should have the idea of what their purpose is. Now this is very broad, I understand that. The functions, the 22 core functions, are how the World Health Organization is going about carrying out that mission. You'll see the funding stream on page 37. It's paid for by the member nations according to how much they're able to pay based on their economy. And you'll see more details on the World Health Organization on page 37, and you can see how much interest, how important in 2003 we found tobacco-related deaths throughout the world. And then in 2004, the strategy was on diet, physical activity, and health. Okay, back on page 39, National Health Agencies. The premier agency in the United States is the Department of Health and Human Services. Everything falls under Health and Human Services. As we come here, we'll see Health and Human Services started under the Carter administration. And their budget is 25% of the federal budget, which if you think about where you want to spend most of your money, I would think it would be on the health of your populations. About $707 billion currently is the budget for Health and Human Services, and that's more than the Department of Defense. Now, one of the things we talk about here starting off is the American Recovery and Reinvestment Act of '09, and things like $19 billion for health information technology, $1 billion for continued effectiveness research in health, all the way down through the 8 items listed at the bottom of page 40, and it talks about the major components of the new healthcare reform measure. So make sure you pay particular attention to that. Now, as you flip on over to page 41, you'll see that there's a diagram there, flowchart, of the Department of Health and Human Services and all the agencies under it. The next few pages actually goes through the different agencies, explaining what their charge is and a little about how they carry those out. So starting with the Administration on Aging, page 43 takes you through the Centers for Disease Control and Prevention. Now make sure when you reference that it is the Centers for Disease Control and Prevention. The next two pages, 44 and 45, list the different centers, institutes, and offices which fall under the CDC. So read through those and they'll give you an idea of how large the scope of CDC really is. Now, on page 46, you'll see the FDA starting off, then for all the administration folks, and everyone, the Centers for Medicare and Medicaid Services, agency who guide the Medicare administration. HRSA, providing research, and the Indian Health Services, and the National Institutes of Health, a premier research agency. Now we go over to page 48. And on the top of that, you'll see the Substance Abuse and Mental Health Services Administration. Now, on the bottom of 48, when we start talking about state health agencies, we're talking there about the core functions of public health. These are the three you have to know: assessment, policy development, and assurance. Now, under that, you'll see the 10 essential public health services, and they're listed there on page 48. On the top of page 49, you'll see how these all work together. So you'll see the areas of assessment, policy development, down through assurance. So figure 2.5 is another one you just have to know. This is one you need to be able to do 3 or 4 minutes on anytime asked. You have to be able to explain how all this works together. On page 50, you'll see the local health departments, be it a city or a county department, and you'll see how it's divided up there on the bottom of page 50. On the bottom of page 50, you'll see the structure there. Page 51, make sure you note the funding stream for local health departments. And then on page 51, we start getting into coordinated school health programs. Now, everyone has sort of an idea of what a coordinated school health program is, and we actually start off listing some of the issues, some of the challenges of coordinated school health programs. Now, why is this such a problem? I put a note in the margin here because it's a chance to reach everyone. Currently, everyone has to go to a school for at least so many years in the United States. This is our chance to spread a healthy message to everyone in the country. We do it through a coordinated school health program. Now we'll flip on over to quasi-governmental health agencies, and the example of this one is always the Red Cross and what we're doing there. These agencies may have a governmental charge, but they still function like a voluntary health agency. On page 53, we talk about non-governmental health agencies. 54, volunteer health agencies, make sure you can define those and what they are. And on the bottom of 54, you'll see the major functions of a voluntary health agency. Page 55, you'll go into the professional health organizations who make the examples are the American Medical Association, Dental Association, Nursing, American Public Health Association. These are the organizations for the various professionals. 57, we go into the charitable organizations. The premier example there is the Bill and Melinda Gates Foundation, who have been investing more in international health than the World Health Organization recently. So that's the philanthropic foundations. And then at the bottom of 57, we get into the social religious organizations. And this examples here are the Kiwanis and the Rotaries and Elks. Corporate America is becoming more and more involved in community health, trying to take care of its workforce as well as the populations they sell to. We see more and more involvement of corporate America into community health, and recently with the fighting of the obesity epidemic. So that's chapter 2. Now come back to the chapter summaries. Read through these and make sure that you can discuss each summary point, and then make sure you can also answer the review questions. And that will wrap up chapter 2 for us, organizations that help shape community health.